Hello everyone. In this video, we will see the water analysis done in the microbiology laboratory in a healthcare system to prevent hospital-acquired infection. Water analysis or water surveillance is information about the disease to prevent the contamination of the illness and further disease outbreak. The environment in the hospital plays an important role in the occurrence of the healthcare associated infections. The various environmental sources from which microorganisms can be transmitted to patients and healthcare workers include water, air, and environmental surfaces. Therefore, monitoring the quality of water, air, and surface are of paramount importance for safe hospital environment. So what is surveillance? Surveillance is an ongoing systematic collection, analysis, interpretation of data essential for planning, implementation, evaluation of healthcare practices, closely integrated with timely dissemination of these data to those who need to know. So according to CDC guidelines, the targeted microbiological sampling of air, water and surface for defined indications like outbreak investigations, that is to determine whether environmental microorganisms are the source of the outbreak, to evaluate the change in infection control practice, like assessing a new methods in sterilization, new equipments used in the hospital. Next is construction. During construction, it is necessary to assure the environment is clean. Next is for research purpose, the studying of the environmental microbial contamination that compared hospital acquired infection rates. So water. So water is the foundation of life. Because of its wet environment leads to the infection, promote the growth of the microorganism, that leads to antimicrobial resistant pathogens and healthcare infections. Though water meets drinking standards, when it enters a building, the complexity of the hospital system creates conditions that allows growth of the microorganisms. So coming to water sampling in the laboratory. So bacteriological examination versus its indications. The first method is multiple tube method. Its indication is extensively used for drinking water analysis, for highly turbid samples. Next method is membrane filtration method for testing dialysis water, for testing clean water where the bacteriological count in water is expected to be low, for testing large volumes of water. Next method is presence or absence method to monitor quality of drinking water where contamination is likely to be rare. So water sampling is used to detect waterborne pathogen of clinically significant or to determine the quality of finished water in a facility distribution system. What are the sources? Two sources, hospital water and water containing devices. So these are the two sampling sources and they are the main reservoirs of hospital care associated waterborne pathogens. We use to test drinking water contaminated with enteric pathogen. Next is test of water contaminated with healthcare associated pathogens. So category 1 is enteric pathogen in drinking water. Those are bacteria, viruses and parasites. So under bacteria, Escherichia coli, O157H7, Salmonella, Shigella, Vibrio cholerae, and Campylobacter. Viruses, rotavirus, hepatitis A and E, poliovirus. Parasites, Entamoeba histolytica, Giardia lamblia, and Cryptosporidium. Under common hospital pathogens which causes waterborne infection is multidrug resistant gram-negative bacteria, non-tuberculous mycobacterium, and Legionella. Source of contamination under category 1, enteric pathogen. So it is the hospital environment and community which is the source of contamination. Mode of transmission, ingestion of contaminated water, and the illnesses is diarrheal outbreaks and a few extraintestinal illnesses. Coming to the hospital pathogens, so the hospital settings and the community, and the source of contamination is illness is potable water, dialysis sink, ice and ice machines. Mode of transmission, ingestion and contact aspiration, etc. And illnesses is serious threat in high risk immunocompromised patients. Collection and transport of water samples. So the water sample to be tested, collected in a sterile screw capped container, and the volume to be collected is 150 to 200. The sampling points where the water has been collected is potable water for pipelines, dialysis water, and dental chair unit water lines. This is how to collect a water sample. So remove the aerate. Before that, select the tap, remove the aerate, disinfect the facet, run the water for several minutes, then you open the container, collect the bottle, collect the water sample and refrigerate or send to the laboratory for test. Microbiological testing of water samples. So these are the methods where water sample collected water sample is being tested for fecal coliforms or hospital pathogens. First is the multiple tube method, second is the ejectment test or the differential coliform count, next is the membrane filtration method. So the first method is the multiple tube method. So this is the most common method used for water surveillance. It is so named because it involves specific volumes of water sample to multiple tubes containing special culture medias. So the culture media used is the McConkey agar. So according to WHO guidelines, the polluted water, the treated water or untreated water is being transferred in specific volumes. So first volume is 50 ml, next is 10 ml and 1 ml to the corresponding McConkey broth. So results, so after incubation for 24 to 48 hours, the medium turns to yellow from purple. If there is due to the lactose fermentation along with turbidity of the medium, and the gas is collected in the Durham's tube. Determination of most probable number. The number of tubes giving positive reaction is compared with McCarthy statistic table to determine the most probable number of coliforms count present in 100 ml of water. So this is called as presumptive coliform count. So this is the MPN statistical table or McCarthy statistical table. So with 10 ml, 1 ml and 0.1 ml. So after presumptive test, the positive tubes have to be confirmed with enteric pathogen. So it has been plated with the special media, EMB agar, and the positive color change is being selected, and the test is completed by putting in lactose broth and nutrient agar broth. So this is the procedure for multiple tube method. The next method is Ejigman test for fecal coliforms. So detection of the coliform bacteria does not always indicate fecal contamination. So it may be due to environmental contamination also. So the further test is done by differential coliform count to detect the fecal coliform, that is fecal Escherichia coli. So this is done by subculturing the positive tubes, that is from the multiple tube method to a lactose medium, and it is kept for 44 degrees Celsius. So if there is a color change and as gas production confirms Escherichia coli, and it is been tested with indole test, confirmation test, which shows indole positive for Escherichia coli. So the water sample is contaminated with fecal coliform. Next test is membrane filtration method. So this is the method based on the filtration of a known volume. So you take 100 ml water and you pass through the apparatus which has a cellulose membrane filter. The pore size is about 0.2 or 0.45 μm. The bacteria retained on the surface of the medium are transferred into a petri dish containing suitable medium and incubated. So color change, so yellow color colonies are being counted, and the result is given in CFU per 100 ml of water. The colonies, so the confirmation of the E. coli, colonies further processed for detection of lactose fermentation with the production of acid and gas at 44 degrees Celsius to detect the thermotolerant E. coli. So that's the confirmation test for a membrane filtration method by using millifore filter apparatus. So these are the water analysis done in the laboratory. So in next video we will show the demonstrate the water analysis done in our laboratory. Thank you.